And Cheryl asks, I still can't wrap my head around the concept of data completeness. I understand that it means we have to report on 70% of all the patients that fall into the denominator. But can't that be derived from looking at a MIPS report that our vendor supplies? Would this not be the percentage that is determined from the denominator and numerator calculation? And is this something that our vendor has to do behind the scenes, or is this something that we can determine when looking at our MIPS report?
Thanks, Cheryl. This concept gives a lot of people trouble. You're right, it's something you should find in your vendor's MIPS reports. But to be accurate in the vendor reports, it has to come from the data your practice has provided to the vendor. The denominator should be a complete count of every patient seen during the performance period that is eligible for the measure. There should be 4 numerators that your vendor generates against that denominator, getting those numerators from your data. As a check, the sum of the 4 numerators should equal the denominator. The first numerator is the count of patients qualifying for a valid exclusion. The second numerator is the count of patients qualifying for performance met. The third numerator is the count of patients for whom performance is not met. And finally, the fourth numerator is the count of patients for whom clinical data is not available or not reported. The inverse of the not reported rate is the reporting rate. It is this reporting rate that has to be 70% or above. Your vendor might report it to you as the not reported rate or the reporting rate. Just be sensitive to which it is. For these numbers to be credible and be able to survive Medicare audit, the denominator count of eligible patients needs to be credible even if the clinical performance data is not complete. Luckily, we at Mingle Health find that visit data from the practice management systems is almost universally available from practices. It is usually possible to source claims data from all practices in an organization and to calculate a credible denominator. Access to clinical data is more variable. It is all accessible one way or another, but access can be cost prohibitive. Today, Medicare is satisfied if we expend the time, effort, and money to collect 70% of the clinical data, and they forgive us the final 30% when it's just too hard to access. Thanks, Sheryl, for the great question. I hope this finally clears it up for you.